Recurrent urinary tract infections. I see women all the time for recurrent urinary tract infections. By definition, this is an infection in the urine, in the bladder, or sometimes it ascends to the kidneys, that happen 2 or more times a year. That's the definition medically of a recurrent urinary tract infection. How I approach a woman with a urinary tract infection is I look at your risk factors first. What are the behaviors that you are doing that are contributing to urine getting old or dirty? The other thing I worry about as a surgeon and as a urologist is an anatomic problem. If your urine is being blocked from leaving your body, or it's being obstructed by stones, or possibly the way you were born with an abnormal drainage system of the ureter, that can all contribute to a recurrent urinary tract infection. So how I talk to women about urinary tract infections is I say, is this an anatomy problem or is this your environment problem? Anatomy problem means that the kidneys and bladder are abnormal in some way that increases your risk of infection. I can usually evaluate this with a kidney bladder ultrasound, and more invasive workup is not necessary. But if we find abnormal findings, either on exam or on simple imaging, then we would pursue a further workup. If your anatomy is normal, then we worry about the environment or your behavior, things that are contributing to urinary tract infections. Some women simply don't like the taste of water or don't like drinking, and dehydration absolutely leads to increased urinary tract infections. Some people have a problem with their stool, either chronic constipation or loose stool or diarrhea. Both increase the stool burden in the perineum and increase the chance that E. coli or other pathogenic bugs are going to travel from the stool into the bladder and cause an infection. Some women don't go to the bathroom enough. We're never taught how many times you're supposed to go to a bathroom in our lives, but normal is about 6 to 10 times a day. I meet plenty of women who think it's very normal to pee twice a day. That'll increase your chance of urinary tract infection because that urine is old. Old urine is dark and warm and dirty, and all the more time for the bugs to grow and multiply and cause you to have symptoms. So normal fluid intake, normal bladder evacuation really decrease the risk of urinary tract infection. Another risk for urinary tract infection is postmenopausal status. And how this increases your risk is that the change in the tissues and the change in the pH down in the urethra, the bladder, and the vagina make pathogenic bacteria all the more likely to colonize and to grow into your bladder. With the change in vaginal pH postmenopausally, lactobacillus, or our good bacteria, can die off. In addition, the tissues can change to become thinner or more susceptible to trauma or to pathogenic bugs. In addition, the change in our pH increases the chance that pathogenic bugs, such as E. coli, will be colonized. There's a simple fix for this risk factor, and it's to restore the vaginal tissues back to premenopausal status with the addition of topical local estrogen therapy. Just twice a week, a small amount can restore vaginal health and help decrease the risk of urinary tract infection.